three dots and arrow up? Should I press on the arrow up?
Yes, ma'am.
Okay. Can you see my presentation?
Yes, ma'am. It's...
Because I don't see it.
It's loading, it's loading.
Okay, thank you. Just let me know when to start, please.
We still can't see your screen. That's...
Okay.
It is sharing, but I don't know. Maybe it's...
Can you see my screen
Yes,
now?
yes, ma'am. Yes, perfectly.
Okay. And then I'm going to...
A view, view.
Oh, view? Okay. And then present. Okay.
Yes. Yes. We are live.
Excellent.
Yes.
Oh, great.
We are live, yes.
Okay.
Everyone's here.
Excellent. Thank you, everyone, for joining. My name is Dr. Sanj, and I'd like to thank Aarushi for welcoming me. I'd like to thank all of you for spending this next hour with me. You know, I'm going to be talking a lot about myself. This presentation is all about you. So please learn from my experiences, learn from my advice that you can not just be a happy dentist, but to be a happy person. So what are we going to talk about? We're going to talk about getting the most out of dental school, how to succeed as a new dentist, the different pathways in dentistry, because I took an unconventional path, my typical day as a dentist, how to be a happy dentist, and then we're going to go through some cases and answer your questions. So I graduated from the University of Toronto Faculty of Dentistry in Canada in 1999. Before that, I got a bachelor degree in biology. So after I graduated, I worked as a dental associate. I worked as a clinical and theoretical instructor at a dental hygiene school. And for the past 15 years, I've been working in public health, which I really enjoy. So this is my dental team, and we're all having fun because we have fun every single day. I love my job as a dentist, and I hope you love your career as well. Aarushi, are there any concerns?
No, I'm very sorry. Go on.
Okay, great. Thank you. So why I became a dentist. So this is a picture of me when I was 7 years old at my dental office, and I was in the cavity-free club, and I remember how excited I was to be on that wall of fame. And this is actually my favorite thing to do now as a dentist, is to tell someone that they have no cavities. So I never wanted to be a dentist. I actually wanted to become a university professor. So when I was doing my Bachelor of Science degree, everything I was doing was leading up to going into my master's and PhD. But in my 4th year of my bachelor's, I was doing a research project on crickets, and I hated it. And so I thought, I have to do something with my bachelor's degree. So I went to my guidance department, and I said, what can I do with a science degree? And she opened up the drawer, and there was only one pamphlet in the drawer for students, and that was to write the dental admissions test. So I didn't have much time to prepare. I did my dental admissions test, applied. Luckily, I had all the courses to get in. Luckily, I had the grades to get in, and I got in the first time I applied. I was so lucky. However, when I was in dental school, I hated it. It was the worst 4 years of my life. I had post-traumatic stress disorder for years after. I didn't walk through the doors of my school until 13 years later, and I was petrified. I had nightmares. So why was dental school so hard for me? It was a brutal experience because of me, because I had a bad attitude. And my attitude was, I wasn't good enough. I don't belong here. I was scared to ask questions. That's why I didn't do well in dental school and why I didn't enjoy my experience. So I would like to share some tips on how you can become, better dental students and ultimately better dentists, because my biggest regret is not doing dental school properly the first time. So I recommend that all of you ask questions. You are spending a lot of money on tuition, 4 years of your life. The instructors are there because they want to be there. They want to help you. So don't feel scared to ask questions. You should be asking at least one question a day to your instructors. The second thing is to be patient. You're all used to being the top of your class, learning things really quickly. Once you get into dental school, all of a sudden you're learning things that you have never done before. And you're not going to be perfect the first time. You're not even going to be perfect the 100th time. So be patient with yourself and don't compare yourself to other people. There are things that you do better than other people. There are things that they do better than you. The main thing is to create progress each day. So if something doesn't go well, instead of saying, oh, that was awful, think, okay, what can I have done to make it better? So instead of thinking of it as a failure, think, okay, I'm going to learn from this. And when I was in second year of dental school, my instructor pulled me aside and said, you really need some extra practice. And at that time, we were working on typodonts. So I started crying in front of him. I felt a lot of shame. I didn't tell any of my friends. But I did go and do that extra practice, and it did help me a lot. So then once we got into clinic and started working on real patients, I did very well. So what I should have done is, I knew I was struggling. So what I should have done is went to my instructor and said, I just can't grasp the concepts really quickly. I just can't get my hands to do what my mind wants to do. What can I do? And at that point, he would have said, okay, why don't you get extra help? So instead of waiting for it to be so bad that the instructor was telling me that I needed extra help, I should have been self-reflective and sought the help. And then that way I would have been in control. I wouldn't have felt bad that someone is telling me that I need extra help. Another thing is to connect with your classmates. So guess what? You're not the only one struggling. All of you are. So you should be talking about that. Tell people, that you need help. They may be willing to give it to you. or give you some advice. Or even if they can't help you, that shared experience of knowing that you're not alone helps a lot with your mental health. And use positive self-talk. I went to a really tough dental school, and my instructors would say things like, "What are you doing?" And, "Oh my gosh." And I used to think, "Oh, I'm a horrible dental student. I'm not going to make it. I'm not going to graduate. I'm not going to be a good dentist." So think about what I was saying to myself. My instructors didn't say that I wasn't going to graduate, that I was going to be a bad dentist. I said that to myself. I was worse on myself than they were. So instead, I should have used words like, "Okay, I'm learning. I just need more practice," or "I need some extra help," or "Let me ask some more questions." That would have been a positive message to myself. And then when it comes to studying, make sure you take study breaks. So instead of having a marathon session where you're studying all night or studying for hours at a time, read the page. Before you go on to the next page, cover it up and quiz yourself and think, okay, what did I just learn? And if you don't remember what you just learned, you either need a break or you need a different way to grasp that concept, which may mean teaching it to yourself, teaching it to others, saying it out loud. So I found the best ways to learn things was either to pretend I was teaching someone and saying it out loud, or actually working with a group of my classmates and us teaching each other. And it's remarkable when it comes time to the test, you actually remember that story that your class used. And I say it several times during presentation is to connect with the dental community. So it's great that you're connecting with your classmates, connect with your instructors, connect to the dental community outside of your school, like through Instagram and Facebook, or meeting them in person. Ask them if you can shadow them at their dental office. Ask questions to people you follow on Instagram. You'd be surprised how much support you'll get. And then the small little world of dentistry becomes so much bigger and you feel like you have so much support. So I graduated from dental school, and then I started working as a dental associate, and I didn't enjoy it. One of the reasons why I didn't enjoy it is because I still had that same mentality that I did in dental school. I felt that I wasn't good enough. I also totally disregarded, what we learned in dental school and thought, I'm going to do everything as fast as I can. I'm not going to bother with the rubber dam. And guess what? My cases weren't very good. Patients were coming back. That just made me feel worse as a dentist. So I wish I can do those first few years of being a dentist again and have a better perspective, have better goals for myself. So what my advice to you is be selective of where you work, because most new dentists work as associates where they work for a principal dentist, which is fantastic because then you have that principal dentist as a mentor. However, you should be actively asking questions to that principal dentist, asking to review cases, and also try to work the same times as that principal dentist. So if that dentist says, I'd like you to work weekends and evenings when I'm not here, you're not getting any mentorship. So if you want to do that, that's fine, but then tell the principal dentist, can I, get together with you, 1 hour a week just to go through cases? And also, I should have asked for help. So on cases which I found really challenging, I should have asked the principal dentist or the other people I was working with or other dentists outside the office for help. And I should have practiced just like I was in dental school. That is the gold standard. So now what I do is after each patient, I will say, okay, how are my clinical skills, my time management? How did I interact with the patient? How did I work with the dental assistant? How was the infection control? All the same criteria I had in dental school, I'm judging myself. And that way I can grow and be a better dentist each day. And just like in dental school, you have to be patient. You have to be patient as a new dentist as well, because you are still learning. And even now, 22 years later, I am still learning and asking for help and being in that growth mindset, the mindset of a learner, so that I can be better and do better for my patients each day. One of the best things I did was join my local dental study club. I joined initially for the continuing education courses, but actually there is a fantastic thing that happens when you join your dental study club is that you get to meet other dentists. Then you get to talk about what's going on, not just in your practice, but how you're feeling, how you can learn. We support each other, give each other advice. And these people that I've met at these study clubs have become my best friends. So connect with other dentists, and you are still a learner even after you finish dental school. So take continuing education courses, but have a strategy. Don't just take any course. Think, okay, if I need help with endodontics, I'm going to reach out to an endodontist, ask her, what course she recommends, and then take those courses. So in the early years of me being a dentist, I thought, well, I have to buy a dental practice. That's what dentists do. And I actually was going through the process of it, and I'm glad I didn't, because practice ownership doesn't suit me. So once you become a dentist, think about whether this is something you want to do. And if it is, make sure you take some business courses and get some support from professionals outside of dentistry, like people in banking and lawyers and accountants, to help you with practice ownership. The reasons why I didn't buy a practice, because owning a business is something I never want to do. I never went into dentistry because I want to be my own boss. I went into it because I want to help others. So I'm fine being an employee. And as an associate, I did not like the business part. I did not like the money part. I felt so guilty at the end, asking patients to pay hundreds of dollars after the dental treatment. And I also felt so bad when someone was making choices on treatment plan based on money and was deciding to take out a tooth because it was cheaper than saving it. And the other reason why I didn't become a practice owner is because I don't like having debt. It really stresses me out. And I would be very stressed as a practice owner because I micromanage. I don't think I'd ever stop thinking about the practice. So I knew practice ownership wasn't for me. So is it the right thing to do? There are a lot of advantages of being a practice owner. You make twice as much money as an associate. You get to make your own decisions, hire your own staff. You're in control. So you're providing a lot to the community. You're hiring people. So it's a lot of perks to being a practice owner, but you have to see whether that fits into your personality. And I'm a general dentist. I work in public health, but I don't have my public health specialty. I mostly work with children's, but I'm not a pediatric dentist. So many people ask me, oh, why didn't I go into pediatrics? Why didn't I go into public health? And the reason why I didn't specialize is because I like general dentistry, where you get to do a little bit of everything. Also, I was sick of school, and I was worried on taking on more debt. But even after my debt was paid off and I could have gone back to school, I enjoy general dentistry so much that I'm happy to do a little bit of everything and refer those challenging cases. So what is my typical day like? So I mostly see children, and I also see seniors, and they're on government-sponsored dental care programs. I work 4 days a week. 3 of those days I work 8 to 4, and one of those days I work 12 to 8. So I work one evening a week. I typically book 1 hour for appointments, and I usually do quadrant dentistry. So for a child, I'll usually do a sealant on their first molar and a couple of fillings on their primary molars. I also focus a lot on prevention. So on the new patient exam, we actually show patients in their mouth how they should be brushing their teeth, and then they show us that they can do it. We go through every single thing they eat and drink. And then at every subsequent appointment, we follow up and say, did you brush your teeth? Are you flossing? Are you rinsing? Tell me about your diet. Do you have any questions? So the prevention is very important. Working in public health, working with vulnerable populations. They have higher dental needs than the average person, so the cavities are very big. I mostly do restorations, big restorations, and extractions. It's very little cosmetic work and prosthetic work. And I really enjoy it because I find that I'm helping the people who need it the most. And I'm also increasing their responsibility for their own oral health. And I'm making them feel comfortable going to the dentist. Oftentimes, people on public dental programs, will only be on it for a short period of time, and then they won't have any dental benefits or the financial means to pay for dentistry themselves. So it's really important for me to make sure that they know how to take care of their own teeth. They care about their teeth and their overall health so that they have less problems in the future. So when I'm doing dentistry and treatment planning, in my mind, I'm thinking they might not go to the dentist for the next 5, 10 years. So I have to make sure this lasts, and I have to make sure they know how to take care of it and to prevent future problems. So I like the preventive aspect of it. It's very rewarding, and we really focus on patient-centered care, where we're looking at the person not just as, what's wrong with their mouth, but as a whole person. So we are looking at how their oral health is affecting their overall health, because oftentimes people who are eligible for these government-sponsored programs, not only do they have a financial barrier to dental care, but there are also issues like language, employment, housing, food insecurity, lower levels of education. So they're struggling in various aspects of their life. And we find that even though they might have the access to the dentistry and, they're living in the same area as people who are very affluent, they are having worse health outcomes, more oral disease, more overall disease. And it's because there's so much stress. It affects their diet, it affects their sleep, it affects their mental health. They have higher instances of disease. So it is fantastic to be in a situation, in a role, where not only can I improve their oral health, I can improve their lifestyles, their livelihoods. I often tell kids when they come in, hey, are you interested in being a dentist? You can be a dentist just like me. Like encouraging them to, be more than what they actually think they can do. So outside of dentistry, I love doing volunteer work. So my volunteer work involves being involved with organized dentistry. So I was the president of my local study club a few years ago, and I am the chair of a committee for my provincial dental association. I'm on the advocacy committee for the Canadian Dental Association. I am involved in advocacy, to ensure there's optimal levels of fluoride in the water to prevent cavities, because in Canada we have very low levels of fluoride, so we have to add a little bit more without causing fluorosis, but to prevent cavities. So I successfully delegated to make sure that our region has optimal levels of fluoride in the water, and that's what I'm most proud of. I write articles for my provincial and national dental journals. I am a public speaker. I do dental presentations to the public as well for children and seniors. And I do community service, like volunteer and do free dental clinics. So I love all the other aspects of dentistry. So to be a happy dentist, I focus on the things I like. So I like working with kids. So I'm in a practice where most of my patients are kids. I like helping people who need it the most. So I work at a public health clinic. I like restorative and extraction. So that's mostly what I do. I like working in a big team. So we have a big office. I love that. And I love how we all work together to make sure, the patient experience is optimal. Now, things I don't like. These are the things I stayed away from. I don't like talking about money. So the great thing with public health, I very rarely have to talk about money because the patients are on government-sponsored dental care programs. I don't like doing, those big full-mouth rehabilitation cases. in public health, those cases aren't covered. So I mostly do, the bread and butter dentistry, like restorations and extractions. But there's nothing wrong with doing those simpler procedures because it is getting patients out of pain, it is improving their function, it is improving their self-esteem. I like helping the people who need it the most, and if I'm leaving my kids to, help others, these people have to need me more than my kids need me. So that's why I like working in public health. Other things I don't like, being in a toxic environment where it's very competitive. I worked in an office like that before, and I also don't like working in an area where it's very aggressive, where they're doing aggressive treatment plans, like replacing all silver fillings, or telling everyone they need whitening, or, encouraging crowns and veneers when they're not necessary. So I don't like that, and I don't like unethical dentistry as well, unethical billing. I just like, to be honest with the patients, tell them, the benefits and risks of all of the different treatment options, and then helping them so that they have less problems in the future. So the reason why I'm happy as a dentist is because I focus more on the things I like, and I stayed away from the things that I don't. So what surprised me about dentistry? The number one thing was how expensive everything is. Firstly, we have the highest tuition in dental school. Then, dentistry is very expensive. 70% of, the money that comes in goes towards expenses. The materials are expensive. The equipment's expensive. We're charging a lot to our patients. So that was the money aspect really surprised me. Another thing that surprised me is that there are a lot of people who don't go to the dentist because they can't afford it. So when I was growing up, I went every 6 months. My dad had dental benefits. It wasn't until I went into the real world that I realized, wow, a lot of people can't afford this. So, I feel very lucky that I get to work in public health where I get to help people who may not be able to afford it if they didn't have a government-sponsored program. So, I was talking about, the money aspect. It's actually very important for dental offices to be profitable. So you shouldn't feel any shame in collecting money from patients as long as you do it ethically. And also, there's a huge financial burden on dentists. When we graduate, we have huge tuitions. So your priority, and this is what I did, was I paid down my student debt. Number one, I was able to do it quickly because that's what I focused on. And the way I was able to pay off my debt quickly was because I didn't spend a lot of money. So don't think that as a dentist you need a fancy car, a big house, luxury items. You don't. I felt I slept better when I paid down my debt than when I purchased something. Purchasing an office. This is, you have to think about whether this is the right thing for you. And if you do purchase your office, and you're in an office, surround yourself by experts who can help you. Accountants, lawyers, financial advisors. You may get a practice management consultant to help you. And I didn't get any business courses in dental school. And even though I don't own my own office, it's very important to take some business courses because your clinic's not going to survive unless you know how to make some money. And you have to understand those financial statements, even though you might have an accountant or a bookkeeper doing your, helping your business, you have to understand what those numbers mean. And you have to market your office. Even as at a public health clinic, we have to make sure that we have enough patients coming through our door, or else the government's not going to fund our clinic. Marketing is really important. And the way to have a successful clinic is to think about what you're really good at and market that. So it might be you're really good at a certain patient group, like working with children. It might be you're really good at, cosmetics. So, the clear braces, clear aligners, veneers, you can focus on that. You can focus on the fact that you can take someone who has a lot of issues in their mouth and do a full mouth rehabilitation and not only make their their smile better, but their self-esteem better. Leadership is very important in dentistry, and we don't learn that in dental school. So whether you're an associate or a practice owner, you are a leader just by being a dentist. And your values, your vision, your culture of the office is going to help lead the entire team. My friends who are practice owners say that their number one stressor is their staff. However, those people who, have no staff, who have very little staffing problems, are the great leaders because they have office policies, they have daily huddles, they include the staff in the business side of dentistry, they have mission, vision, and values for the office. Every single person on the team is working towards the same goal. So in order to have a great team, you need to have a great leader. So just think in sports, yes, everyone has a certain position, but there's still a captain of the team. There's still a coach. Without that, your team is not going to win. And your dental team is also a team. So if you want it to succeed, you also need good leadership. Ethics is very important so that otherwise, your patients aren't going to come to you. Patients talk, and if they realize that you are interested more in the business aspect than them, they're not going to go to you anymore. So you have to always remember you're a health profession first, then you'll get the trust of the patients, and then the money will come. So how to be a happy dentist? Again, I'm going to say this, connect with other dentists. A lot of people don't understand, our lives, and people who understand the most are people who are going through the same thing we are, so other dentists. So when you graduate from dental school, stay connected with your classmates, but also connect with other dentists. Get a mentor and ask for help. Even on Instagram, ask someone that you follow a question. You're going to get so much support. Volunteer. It brings so much joy. It actually helps. I find that it probably helps me more than the people I'm helping. It's very rewarding. And I get to do what I'm good at, which is helping others. And I get to share my skills as a dentist without, asking the patient for money because I'm providing them with free dental service. So I'm reducing that barrier. And I like also volunteering and just teaching oral health promotion. I like volunteering by helping my profession and advocating for the public and, creating a community with other dentists. So that is so rewarding, just as rewarding as dentistry. And the most important thing is to find your own path. So don't worry about what everyone else is doing. Don't worry about what they're going to tell you if you decide that you're only going to work 1 day a week, or you're going to move far away, or you're going to take 10 years off and raise your family and then go back into dentistry. You may decide to quit dentistry and go into another field. You may decide to, be a practice consultant and not do clinical dentistry anymore. Do what's right for you. And if you judge other people less with their decisions, they're also going to judge you less. So find your path. I felt like I wasn't a real dentist because I didn't own my own practice, because I was no longer working in private practice and I went to public health, that I was teaching. No one else was thinking that. I was thinking that. So once I, started becoming confident and saying, you know what, I'm doing the right things for me, other people started coming to me and saying, can you help me now? So I have a friend who decided to sell his office and work on a business of offering, temping solutions to dentists, when they have an assistant or hygienist who can't come into work. He would find temp assistants and hygienists for them. And, we're all shocked, like, you're selling your office? It's a very successful office. What if your temp business doesn't do well? And he's like, well, if it doesn't do well, I can just buy another practice. Like, you have to think like that. Do what's best for you. If it doesn't work out, you can go back to it. So do more of what makes you happy do less of what doesn't. You may have to take some risks in doing that, like cutting your hours, working shorter shifts, but do it. Surround yourself with great people, not just your friends and family, but also your dental team. Also have experts around you that can help you with your weaknesses. So if you're not good at bookkeeping and accounting, hire people to do that for you. So overall, do what's best for you. Other things to be a happy dentist is you have to be a healthy dentist. This is a career that you may be doing for 40 or 50 years, and it's very hard on the body. So you have to practice good posture, get loops with the light. Work on your back and core. So I have never had any back issues, and I work on kids, and I've been working for 22 years. Why? I do strength training. I make sure I exercise my back and core at least once a week. I do yoga. I do stretching. I've never had to have a massage or go for physiotherapy or chiropractor therapy for my back. And that is because I make sure that I'm healthy so that I can have a long career. And also, I've noticed my eyes have been straining a lot. You probably notice I'm blinking a lot. My eyes have gotten drier just because we're staring at screens a lot more. And also during dentistry, I have my loops, I have my light, now I have my face shield, I have my N95 mask. I'm straining my eyes a lot more. So I'm being very conscious to make sure that I'm taking breaks with my eyes. So when my assistant is curing my composite resins, I will close my eyes or look away. And I try to reduce my screen time as well, because if you have poor vision, if your hands are no longer working well, you're not going to have a long career as a dentist. So taking breaks doesn't just mean, take a 15-minute break at least once a day. It means schedule out your vacation time. So there are some dentists where every 3 months they take a week off. Schedule that in at the beginning of the year that you're going to take a week off, book it off your schedule so you don't have any patients booked, so it forces you to take that break. Because you need that for your mental health and also for your physical health as well. Because dentistry is very demanding. And don't work long hours. I would not want a dentist working on me, at hour 10. I work 8 to 4 or 12 to 8. Do not work those 12-hour shifts. I make sure I have a 1-hour break. I may use that to catch up with my paperwork, but at least I'll be able to sit and eat for half an hour, and then I try to go outside for a walk before I see my next patient. And dentists have been talking a lot about burnout, compassion fatigue, where we're taking in all of the problems of our patients and internalizing it. The stress of dentistry, the stress of running a business. Recognize that at the beginning. And it's very easy to recognize it. You're not sleeping as well. You don't have time for your hobbies. You don't have time for your family and friends. You're tired at the end of the day. You're tired on Monday, let alone Friday. So as soon as you see that, stop and make changes. It may mean working less. You're going to make less money, but at least you're going to be a happier and healthier person. Managing stress, you have to identify it. Deep breathing. So a lot of these things I actually work on with my patients as well when they have dental anxiety. So I mostly work with kids, and a lot of them are very scared to be there. So I breathe slowly, and then I tell them they should be breathing slowly. And we breathe in and out together. And both of our stress levels decrease. Talk to others about the stress you're having. You may even need to get professional help, like talking to a counselor, and that is okay. It actually means that you're taking control of your life and you're not letting stress take control of you. Go out in nature, exercise, make sure you're eating healthy. It takes just as much time to eat an unhealthy item as it does to eat a healthy one. So make good choices. I used to, in dental school, after each 1-hour class, I would walk around the building for a minute, get out in nature. I would always make sure I had healthy food around me, like snacks, so that I wouldn't be grabbing the fast food. I would sleep at the same time each night, wake up at the same time each morning. So that helps with your sleep routine. And recently I started meditating, and I thought this was woo-woo and this is crazy, but it actually works. I was able to be more focused. I was able to be more productive. My stress levels decreased. I wasn't yelling at my kids. It works. Mindfulness also works. So if I'm getting stressed, I will actually say, I feel my heart rate increasing. I feel really stressed right now. There's nothing I can do about it. So, let me just do some deep breathing. Mindfulness also means when I'm brushing my teeth, I'm not concentrating on anything else but brushing my teeth. So that way my mind's not going everywhere. I'm not thinking about 10 things at once. Journaling, I didn't think this worked, but it does. I used to process things in my head and say, yeah, I'm processing all of my feelings. But then, I've been hearing all these things like, no, if you write it down, it actually makes you process it even more. And I started doing this and I thought, it actually works. So now I think of my journal as my worry book. So if I have any worries, anxieties, I will write it down. And then I'll close it and then I'll say, my worries are being taken care of. I do not have to think about them anymore. The next time I feel anxious, I will write it down again. It actually works. And asking for help, I've said this, do this during dental school, do this during your first year as a dentist. Ask for help anytime you need it. People want to help. And then you have to express what you're going through. And a lot of people think, oh, I don't want to talk about it because then it's going to give it energy and it's going to make others think I'm weak. But actually, when you talk about your struggles, it actually releases the energy. You'll feel less burdened, and people will be supportive, and they will think of you as stronger because you're talking about it. And what's interesting is that other people will say, I feel the exact same way. And that creates some unity, and that decreases the stress as well. So if you're interested in coming to Canada and working as a dentist, and you're an internationally trained dentist from a non-accredited dental school, so non-accredited would mean that you went to dental school outside of Canada, outside of the US, outside of Australia, New Zealand, Ireland. So for example, India, it would be considered a non-accredited dental school. So you want to come to Canada, that's great. There are two ways that you can become a licensed dentist in Canada. One is to do the National Dental Examining Board equivalency process. So this involves, handing in your transcripts, but also doing a knowledge-based test, a test on your clinical judgment, and then you'll be doing a clinical hands-on test. You're working on mannequins, doing different types of preparations to test your clinical skills. Then if you successfully pass those 3 exams, then you can write the NDB board exam along with the Canadian dental students. So there are preparatory courses that can help you with these examinations. The other way is called the International Dentist Advanced Placement Program, or IDAP, where you can go to one of the Canadian dental schools, and it takes about 2.5 years, where you do a 6-month intense training along with other internationally trained dentists, and then you do the final last 2 years of dental school with the other Canadian dental students. So either way, you will become a licensed dentist, and if you want to come to Canada, that's great, but just know that there is a high supply of dentists in Canada. So if you do come, I'd recommend working outside the urban areas where you can be busier. But every single person I know who has come to Canada from another country and they're internationally trained, they've been successful, even in urban areas. So you will do well in Canada. So now let's go through some cases. So this is an interesting case. You can see that there are some missing teeth. So what condition occurs where you have missing teeth, thin hair, thin skin? So this is ectodermal dysplasia. So not only is it interesting because it's not very common, the person's missing a lot of teeth, and you have to think, how are we going to, restore this person's function? The other interesting thing is his mother, for many years kept going to the dentist saying, it's weird, he still doesn't have baby teeth and he's 3. And the dentist saying, oh, it's normal, it'll come. And then, he's like 8, and the mom's like, he still doesn't have some of his baby teeth, and he still doesn't have some of the adult teeth that should be in by now. And the dentists are like, oh, don't worry, it'll come. Like, listen to moms. When they are concerned, you should be concerned. And the other thing is, this is a family that was low income. So they're not going to be able to afford a lot of advanced treatment like implants and orthodontics. So this was a case from my office where another dentist was the child's dentist, and she looked into what we can offer the family without them having to pay a lot. So there was a children's hospital in Toronto that was able to take on this child and, with reduced rates for the implants and the braces, which is fantastic. So this person's going to get braces and some implant-supported dentures. Another situation where you should listen to the parent is, this mom during the pandemic said, I've taken my child to 3 different dentists. He has pain. None of them can find out what's wrong. Everyone's just saying, oh, it's just baby teeth getting looser and new teeth coming in. But then I thought, there's something more happening here. So I actually checked the tongue, and I found a lesion on the tongue. And I thought, kind of looks like an ulcer, but the child's saying he didn't bite his tongue. Let me bring him back in 2 weeks and see if it goes away. It did go away. But then on the other side of the tongue, there was a lesion. And I thought, what's going on here? Why is he getting lesions on the side of the tongue? And then I thought, okay, let me see him back another 2 weeks. Another 2 weeks, that side healed. Now he has these like weird bumps on the other side. So I actually had to go to Google, and I found out he had lingual papillitis, which are called live bumps. And it's usually caused from stress. It's virus related, where the child gets bumps on the tongue. So the parents were so relieved that this wasn't a cancerous lesion. They figured out what was wrong with their child. So look beyond the teeth. Okay, here's another case from my colleague that I work with. And she was like, look at all the calculus in this patient's mouth. And I said, that's quite a lot. Like, even if someone doesn't brush and floss, they shouldn't have that much calculus. And then when I asked about the medical history, she said, oh, she's on a feeding tube. She has a condition where she can't swallow. So she gets everything from a feeding tube. She doesn't actually chew food. And I said, that's why she has a lot of tartar. If you're not chewing, or if there's even an area of your mouth that you're avoiding chewing, you're going to get a lot of calculus there. So then I told the dentist I work with, I understand that she can't eat because she's not able to swallow, but tell her to chew some gum during the day and then spit it out, because you need that chewing action to actually disturb the plaque so that you don't get this much tartar. Okay, here's a case where it's a little cute 2-year-old girl, but she has cavities in her front teeth. And they're big. From the lingual, they're huge. And she has some smaller cavities elsewhere as well. So what are the options? She's too small to get treatment done in the office week. So the other option is general anesthesia. Another option, just leave the cavities and wait for them to hurt. Neither of these options are good. General anesthesia carries some risks, and the mom did not feel comfortable having her child put under general anesthesia. So I said, let's use something called silver diamine fluoride. So it's something that's painted on the teeth, and it's arrests decay. It stops decay. So as you can see, that not only did it stop the decay, it's actually a hard surface now, whereas before it was soft. So the decay is not going to progress. The side effect? It turns the carious lesions black. So unfortunately, it turns the teeth black in the areas of decay, and this is the child's front teeth. But the mom and the child were not concerned. They said they'd rather they have these black spots on the teeth than undergo a procedure like general anesthesia. Okay, here's a case where, a young child avulsed her front tooth. And the mom came in with the child in the tooth 3 hours later, and the tooth was wrapped in a tissue in the mom's pocket. So ideally, if a tooth is avulsed, it should be put back in within 5 minutes, maybe up to an hour. If it can't be put back in, it should be kept in a container of milk or a container of spit, or even kept in the buccal mucosa so it can stay moist. None of those things happen. Some people would say, hey, it's a lost cause. You're going to have to wear a denture until you can get an implant when you're older. I thought, doesn't hurt to try putting this tooth back in. So I put the tooth back in, splinted it. A root canal was done about a week later. The tooth is still there. It actually worked. And we took x-rays. I told the mom, I said, the root might start breaking down. There might be resorption. That didn't happen. So she still has a tooth. So when there's nothing to lose, try. Okay, here's the case. If you look on the bottom, you can see there's a chip on 2-1 from a bicycle accident. And the lower lip kept bleeding hours after the fracture. And let's see where that broken tip is. The broken tip is in the lower lip, as you can see here on the x-ray. So that is why the lip kept bleeding. The broken piece got dislodged in the lower lip. What should you do? So you can leave the broken piece in the lip. However, this case is me. The broken piece could be seen from the outside. So an oral surgeon friend of mine removed that missing piece, and my friend restored my front tooth. So the future of dentistry, we're going to see enhanced infection control precautions because of the pandemic. One of the things I love about dentistry is all the new technology. We have to focus on practice efficiency because things are getting more expensive with the enhanced infection control. In Canada, we have a supply issue. We have too many dentists and we don't have enough assistants. So we are really promoting more people to go into the dental assisting field. We have to focus on prevention. The best dentistry is no dentistry. Especially with less people being able to afford dentistry, we're really need to focus on prevention. And we also have to tout the fact that oral health affects overall health. So that way people are going to want to go to the dentist because they know that oral health is integral to overall health. And they're going to view us not just as dentists, but actually doctors, because we are improving their oral health. So there's been a lot of studies to show that there's a relationship between oral health, diabetes, cardiovascular disease, Alzheimer's, even COVID. People who have periodontal disease and COVID are up to 9 times more likely to die, more likely to be hospitalized, more likely to be on ventilators. So that is proof right there that oral health is related to overall health. And we have to advocate to improve access to dental care because a lot of people can't go to the dentist because they can't afford it. And we also have to improve dental school, the curriculum. Just think of how much better it can be if we focused on, mentorship. Maybe during the summer breaks, we can have business management courses, talk about patient experience, practice efficiency, improving access to care. In Canada, it'd be great if there was a mandatory 1-year residency after the 4 years of dental school, which helps mentor and support young dentists. And if dental school improves, if we are more supportive of each other, we'll have happier dentists. And dentistry is a fantastic profession. I am so glad I went into it, even though I was an unlikely dentist. I was unhappy during dental school, unhappy during my first few years. I found my own path, and I'm here to discuss the fact that you can have a fantastic future as well. So think about your values. Think about why you went into dental school. So if you went into dental school to help, the needy, then that's what you should be doing. If you went into dental school because you want to do those full mouth cases, which totally changes a person's life, then start doing that. Think about what type of dentist you want to be. Do you want to work with kids, seniors, everyone? Do you want to work in the city or the country? Do you want to be the dental office that just works for limited hours, longer hours? Do you want to specialize? You have to think about all these things. And instead of asking someone else, do you think I should specialize? Ask yourself if that fits your values and your personality. And in order to have a happy career, you also have to think about, okay, how can I manage my profession with also my goals for my family and having hobbies and making sure that I have time for myself. And that's how you will be a happy dentist. So I really appreciate your time. I would love to answer your questions. If I don't have the time to answer your questions now, you can email me at sanjuktamohanta@hotmail.com, or you can send me a DM on Instagram at Dr. Sanj Mohanta.
Thank you so much, ma'am. It was a lovely session, amazing session. We do have some questions in the live
Oh,
chat.
great.
Yes, ma'am. I'll just read them out. Well, Ria is asking, ma'am, if we have to do specialization from Canada, how to do it? I think you answered that question.
Yes, to specialize. To specialize in Canada, you still have to, go through all the steps, many steps again. So she can send me an email and tell me exactly what specialty she is doing, and then I can give her a more direct answer.
Someone is asking, how do you deal with everyone around you is specializing and you are confident of your skills, but then everyone keeps asking you about when are you going to specialize? I think that's what they're saying.
Yeah, so I felt the same way because a lot of people were saying, when are you going to own your own office? And I was very confident in my answer, saying, I love to be able to help everyone and do a little bit of everything. I am so grateful that there are specialists around me. And just be confident with your answer, because the more confident you are, people aren't going to question you.
Someone's asking, is it better to do fellowship programs before joining any clinic in Canada?
Actually, you don't have to do a fellowship program. So in Canada, fellowship is considered as something you do with a specialty. But maybe this person is asking if they have to do like a 1-year residency. I'm not sure, but you can graduate from dental school and go straight into the application process of being licensed in Canada or the US. You don't have to do any sort of specialty fellowship or residency.
Someone's asking, getting license is a tough job or easy?
Actually, it's everyone that I know who has tried it, who has gone through the process, has been able to do it within a few years. So it is competitive. It's competitive to get into dental school, and it is competitive to get into the IDAP program, where you go through the last 2 years of dental school. And it is challenging to go through all the exams, but I know so many people who have done it. So I would suggest when you're connecting with people who have gone through the program, they can provide a lot of help. And also, if you are in Canada and going through the NDB equivalency, where you're doing all the series of exams, is to take the preparatory courses. So if you can get through dental school, you can get through the application process in Canada.
Well, that's all the questions we have. Thank you so much, ma'am.
Oh, you're welcome.
It was an amazing session, and thank you so much.
Thank you. Good luck to all of you.
Yes. Thank you so much, ma'am. It was great to have you.
You're welcome, Sushi.
Thank you.
Bye.
Have a great day. Take care.
You too. Bye.
Bye-bye.